Hello, this is Manny Ramos, your host of Rise Up, Real Issues and Stories of Every One of Us podcast. First, let me talk about who we are. I'm Manny Ramos, a board member of PNAA, a past president of the Philippine Nurses Association of Central Florida. I'm a professor of nursing at Valencia College in Orlando and an adjunct faculty at William Patterson University. With me today is my co-host, Mindy Ofiana. Mindy?
Thank you, Manny. Welcome, everyone. I'm Indy Ofiana, Legislative Committee Chair for PNAA, a corresponding secretary for PNAA Foundation, and past president of PNA Southern California, an adjunct professor at Charles Drew University, Department of Medicine and Sciences here in Los Angeles. Manny?
Thank you, Mindy. Today, we have a special guest, Dr. Reynaldo Rivera, who is the Director of Nursing Research and Innovation at New York Presbyterian Hospital, who has sparked many innovations and implemented the PEACE model, a professional practice model for evidence-based practice. Dr. Rivera served as President of the Philippine Nurses Association of America and currently a board member of the American Association for Men in Nursing Foundation. Dr. Rivera received the 2022 Exemplary Nurse Leadership and Mentoring Award from the American Organization for Nursing Leadership and is a fellow of the American Academy of Nursing. Good afternoon, Dr. Rivera. Welcome
Good
to Rise Up.
afternoon. How are you?
Very good, sir.
Good to have you at Rise Up, Dr. Rivera. How have you been? I've not seen you for quite a long
I
time.
know it has been, I haven't seen a lot of people for almost 3 years now.
I know.
I
Um,
know.
I know we are going to be talking about how you participated in research, but we would want to talk to you. We want to know you more a little bit. So, my first question would be, where did you grow up and how was your upbringing? And did that affect you for what you have become?
Yeah, I grew up in Manila, right? And I lost my parents when I was, I lost my mom when I was 5 years old and lost my father when I was 10 years of age. So, but then, I was raised by my aunt and my sister, my eldest sister, and that's how it is, and that's life, right? But then I learned a lot of leadership growing up, and also being resilient is very important to me. And you move
Oh,
up, and
that must have been tough, Dr. Rivera.
it
Yeah.
was, but there were also, other people who supported me and my family. So, and my eldest sister was there for us.
So, would you consider your sister to be a huge influence to you
Yes, and my aunt.
and
They
your
are,
aunt?
yes, they taught me the values of learning, of being resilient, and, those kind of stuff.
So, growing up without parents and being taken care of by your elder sister, what do you think would be the five words that would describe you? You mentioned resilient.
Yes.
What else would that be?
Uh, One important values that I have, I think, is that to pay back. I'm very, whatever I have, I share it with other people, and that's very important to me. Being man for others. That's my mantra. Is that it's if whatever you could give with other people, that's how it is. Right?
So, what made you interested into going into nursing?
What made me interested in going to nursing? So I actually at the beginning I wanted to go to med school, but
Uh,
I'm very reality based. We can't afford to go. I can't afford to go to med school. But my sister was at the University of the Philippines doing her pre med. But when our parents died, she has to work, and she raised us, right?
well,
And she influenced me a lot in a way. But then I'm reality based. We can't afford medical school.
Mhm.
So I went into nursing. She supported me throughout my college.
I see. Was that
Yeah,
tough? Was that tough for you?
it was tough, but there, as I said, there were other people who supported. My aunt supported us, so that was great. You know, yeah. So I was able to get a scholarship someone was offering me,
Mhm.
but I was ready to go to the United States.
I
So
see.
I said, all of us most likely went to the United States for economic reason, but I said, oops, no, I am, you
Uh,
know, I'm ready to go. But also, growing up, because I graduated early, younger, um, at 19, 20 years old, and I had the opportunity to work with like Carol Yamanzares for child psych, and I worked with her, and she motivated me to go back to school. And I said, okay, I'm going to the University of the Philippines to do my master's. And she said, Ray, it's better that you go with other field other than nursing. So, and then I said, okay. And she said, why don't you go to Ateneo de Manila for your psych? I said, oh, Carol, I don't have money. So, and then she says, oh, I'll call Father Bolatao. And as long as you pass the exam, maybe he'll be able to help you. So I
uh,
called Father Bolatao. I went and I was there waiting in his office. And he said, okay, take the exam. So I took the exam and I passed. So then I said, okay. So I got accepted. But the thing is, I have to take 30 credits before you go into for your masters. So it's like going to Ateneo for a year. So
uh,
for a year, was I was with the senior. They're younger. Well, all of us are basically the same age. So I went for a year. The senior year took a lot of classes, and then went into the master's program. So, and then that's great. And then I said to myself, I wanted to teach.
mhm.
So in Ateneo and at De La Salle, you don't apply. You're invited to teach. So I have a classmate who's working at De La Salle, and I said, "Oh, I said, I can I apply?" And she said, "Let me speak to speak to the chair." And she did, and I was highly recommended, and I got in. I taught
Wow.
at De La Salle, so
So
at
how
that
long did you teach her and
I
until when?
was young. I was maybe 21 years old. And I was teaching. I was teaching then general psychology, human
Mhm.
resource management. Let me tell you, when I used to teach a human resource management for engineering students, I didn't even manage a group of people, But I know the book very well. I could recite it. So, and they were most of them are the same age of mine. They're in the
Uh-huh.
20s. You know, but I did, and now if you ask me to teach any human resource management class, I've experienced it, right? Or
Uh-huh.
right, I could teach it without reading the book. It's
Uh-huh.
different, it's experiential,
Right.
kind of thing that I could teach now and then share to the world.
Yeah. Not to change the topic, but Manny a while ago mentioned about peace model. So,
Mhm.
can you
Yes.
Yes.
describe that framework and how you
Yes,
launched it?
yeah, the PEACE model stands for P, problem identification, E, evidence review, A, appraise the evidence, C is you change practice if the evidence is there, right? Overwhelming, and the evidence is there, you could change your practice. Or C, you could conduct research if there's a gap in knowledge, And then the last E is you evaluate the practice change and disseminate the findings. So that's very important. If you do a research project, it's important that you, as a researcher, to disseminate the findings.
So how is this working where you're at?
What's that?
How is the peace model at the work at your workplace now?
Oh, we this is adopted here. The peace
Uh,
model was actually developed and designed by our clinical nurses. What we
uh,
did is we inspired them to look at
uh,
the different models available, right? The Iowa model, the John Hopkins model, and then they said, why don't we design our own? So then they came out with the acronym PEACE.
uh-huh.
And now, that's the most important thing. So now it comes from them, and it's really very easily remembered about
Mm,
what those steps are.
I see.
okay.
So in any change, there's always challenges and opportunities, right? When you had that launch, can you share if you had any of those?
Yes. Okay. At the beginning, when we did the peace model, right? We did an assessment, right? We did a combination of some mixed method. We asked people about what are the barriers, etc., etc., and we also did the focus group, and we came out that there's lack of mentors, right?
Mhm.
uh, lack of mentors, lack of time to do research, right? Those kind of things. So you could see that in the literature. Those all the barriers that we identified are very evident. So what did we do? We have our mentors. We partnered with Columbia University School of Nursing. So um, point 0.5 of the FTE comes from I have six now, five people now, scientists. So each point 0.5, right? Each of the 5.5, they work at the university, and the other point 0.5 works at school at the hospital. So that's very important. So we have a nurse scientist. We have the link
Mhm.
in. We call it the link program, right? It's a joint appointment, right? So we solve that, and also we utilize all our affiliations, right?
Mhm.
We have affiliations to assist us in building a culture of inquiry and scholarship, right?
Okay.
So what else did we do? We do not have time, right? They said the nurses complain that they don't have time to do research. So what did we do? We have an academic research fellowship program. It's competitive, but we provide nurses one shift a month for 2 years to complete their study. It's competitive, but let me tell you. So that's other thing that we did. We have also our model, the peace model. So we have a class which we call the peace model deep dive. So we really look at all the stages, if you will, and then we teach them. And then of course, we have a very strong professional governance or shared governance. So we build it, we utilize them. And also in the literature, the CNO are not supportive, but here at NYP, where I work, they are all very supportive. So I cover the whole enterprise. I have 11 hospitals.
Mm.
So yes, but they are, a very strong professional governance, and then we have a very robust EBP and research committees. So those kind of things is really very important. When there are also, there are barriers, of course, as I said, we identified, but we kind of problem solve that, and it's in the book.
Great,
What I'm
great,
Yeah,
talking
great.
about, they're all
in
there.
the Haina.
Now,
Okay.
I want to bring us to the other side of research, and I'm talking about participation in research trials. Now, I've heard um, that you have participated
Yes,
in
in the
some.
All of Us research program.
Cool.
I
So,
did.
would you be able to talk to us
Yes,
about that?
the All of Us research program is a very historic effort.
Uh-huh.
They invited people, or they invited people. Their target is about 1 million or more living in the
Mhm.
United States to accelerate research and improve health. So the important thing here is that they want to collect data and to learn how our biology, lifestyle, and
Mhm.
environment affect health, genetics and genomics, right?
Uh-huh.
So that it's an intersection of those three factors. Again, biology, lifestyle, and the environment affect health, right? So that's very important. So, and Filipinos, Asian are not usually not represented there. So
Mhm.
as either minorities, right? Especially with Asian, when you talk about Asian, there's a lot, it's a broad categories, right?
Right.
Not even Filipinos is part of Asian. So even with the
Uh-huh.
data gathering, you have Chinese are Asians. What else?
Mhm.
Indians are Asians, right?
Yes.
Koreans are Asians. But all of us are totally different from each other, right?
Mhm.
So
Yes.
and that's tough. So I said, if I join all of us research program, I will be contributing, right?
Yes.
And learn more of how could we prevent this disease and treat. This is part of precision medicine. Precision medicine is basically it caters it means that the research caters to it accounts for the genes, the environment, and the lifestyle. That's precision medicine. And this is great. This program, the All of Us, is open to all, right?
Uh-huh.
and
Mhm.
um, and the beauty of it is participants have access to their information, right? We are partners with the researchers, right? We
Wow.
could see now, in fact, when they took my blood and my urine sample, and now I know where I came from. I that a greater percentage of my thing is with Chinese, with Indian, Sri Lankan,
Really? Wow.
minute kind of. I thought I will have a lot of Spanish because of my mother's side, but it's very minute. But
Uh-huh.
the Indo-Malaysian, I have a very strong Indo-Malaysian,
Wow.
so. No, it's not. I knew it was a. It's just. I thought I will be a little more with European now, not much. So there are no other surprises because I know, Um, well, this is the other thing that you did not ask yet, but I will provide you the information. We are six
Uh-huh.
in the family, right? But we lost our parents young. And three of my sisters, when they reached 60, they all died of cancer.
Oh.
So for me, it's good to really, I said, oh, let me really participate this. Maybe there's
Mhm.
something. And also, I have a type of cancer now, and it's a prostate cancer, and I which was removed in 2016, and came back last year, and then what's surprising to me is that I am positive for BRCA.
Mhm.
BRCA for the breast
Right.
cancer.
Right.
So most likely the three sisters of mine that died have that,
Mhm.
but never tested. But then, of course, believe it or not, I had a mammogram when I learned that I have BRCA, positive for BRCA. Thank God, goodness, I'm negative. I mean, I don't have breast any other problem there. So, but I did. So these are part of precision medicine.
Right.
So it's great to learn the body, the biology, the lifestyle, and the environment. So.
Now, I know that with the line of work that you do and being in healthcare and your close connection also with NIH, I'm sure that you are abreast with all of this information, including this research. But how did you get to know about the All of Us research
Oh, well, we
that,
are an active, my institution is an active participant of all of us. research
Okay.
program. So actually, we invite all of us program people to our
Mhm,
EBP research committee.
mhm.
So come join us. Yeah. And also when I see, especially Asian, I'm biased a little bit,
Uh-huh.
but I want them to participate on this. This is very
Uh-huh.
important to us, and to
Right.
other minorities as well. I want us to be
Yes.
represented. So don't forget, joinallofus.org and that click that. I mean, type it and join. There are
Uh-huh.
other across the nation on how to join. So joinallofus.org.
There you
Okay.
go, folks. Listen to that.
I know. A
Joinallofus.org.
nice
Yeah,
advertisement. So, anyway, Dr. Rivera, how are you?
I am fine. I'm doing very well. This is I need to complete a 6 months treatment. It's my third month, and tomorrow I will have another because it's ending at the end of the month, right? Because I was at the AONL getting my award last week. And tomorrow
Congratulations.
I will have my blood works. So far my PSA is down.
Oh,
Uh-huh.
Before there
wow.
was a
That's
time
good.
like in for about 6 months, more than 6 months, the PSA is going up and we cannot find it. What's the problem? So I had three PET scan, and finally they have a specific PET scan for prostate, and then they were able to detect the metastasis was on the sacral area, and then I had this hormone therapy. Now the PSA is down, so
Okay.
really negligible. You cannot, it's not it's not really that high, but for if you don't have a prostate, if it's more than 0.20, that's high,
Yeah.
so it's going up. So now it's negligible.
So
So
you mentioned earlier
I think I'm doing
participating,
well.
right? So you mentioned earlier participating in this research, you actually get to access the data, your
Yes.
data. But do you think, and I heard you also say invite more Asians to join, and I agree with you. But what do you think? Is there what do you think affects the willingness, I guess, or hesitation
Uh, I
to
think we
join
need to ask
research
people
among
to join.
Asians?
That's one
Huh?
important thing because some people, we need to tell them the importance of it, right? If I ask Mindy and you, this is very important, it will help us prevent diseases
Uh-huh.
make our treatment better for other depending on the genetics of the person, people will join.
Uh-huh.
I think we just need some people, maybe they don't like blood to be drawn, but the urine thing is easy to do, right?
Mhm.
Maybe the extraction is the concern, but we are all in healthcare.
Uh-huh.
If we ask the people from Philippine Nurses Association of America to do, we donate, I mean donate, not donate blood. We have blood works every year, right? At least. So
Right.
this they will. There's nothing, it's easy. We just
Right.
need to inform people the importance of it. If we do not approach them, they will not be engaged.
Do you
If
think
you
that
tell
it's
them the
easier?
importance of it,
Mhm.
probability is great, I
Do
think.
you think it's easier for healthcare related professionals to understand that and perhaps affect their decision to join? And how do you think about the non healthcare people or the lay people?
Yeah,
What do you think
I
is?
you will be surprised. I could talk to my cleaning lady, and yeah, and I'm trying to inspire her to join. I think I'll be able to convince her.
Mhm. Okay.
Let's say you're not interested or you're not engaged.
Yeah.
If you have to do it all over again, will you do it all over again to be part of NIH, all of
Yes.
us program? I
Yes.
see.
Yeah, because I think especially with me because of my family, right? I lost my parents at an early age.
Mhm.
those kind of things, you'll be wondering why. You know, in the United States, it's different. I tell my family, if I am still in the Philippines, maybe I'm dead. I've stand place when I was in my 50s, and then I have a defibrillator, right? So those I have a lot of comorbidities, you know.
I see. Well, the only thing I
Yes,
know about you is your high blood sugar.
yes, yeah. But now I join a lot of those studying the Dexcom that monitors 24 hours. It helped me so much. I monitor my blood sugar. Now my hemoglobin A1C is sometimes the ballpark of 6 to 6.1 too.
Great,
Yeah.
great. So, to our listeners and viewers, Dr. Rivera, what would be your, especially earlier you mentioned about increasing the diversity, right, in participation in research, clinical trials to get more data about essentially all of us, right? Representation in research and findings. What would be your message for minorities and increasing the diversity in
Yes.
participation in research? What would do you think would be your message for them? What would
That
be the value of it?
Yeah, my message is that participation is open to all,
Uh,
and that we are partners with this. Participants are partners to improve the health of the future, and also maybe in the future children will be able to join, but at this point not, right? So it's for adult, right? So and that you need to be transparent to earn their trust, right? You know, and the data are secured, right? The data are secured, and what else? I should say secure, and security and privacy are the highest importance
mhm.
for this study, and this program is a catalyst for positive change, you know, in terms of health care, you know. So I will say, come join us, you know. Yeah, sure. That would be great. So make sure. So this is a test for you. What is the website?
Join all of us
Joinallofus.org.
.org.
Joinallofus.org. So Manny and Mindy, make sure tonight you will be
We'll
logging
sign up,
in and
right?
look for, yes, sign up. So I think we need to advertise. We need to advertise this in July here.
We
Uh-huh,
are. In
uh-huh.
Yeah.
fact, I'm introducing this at PNA Southern California. We're actually having a community outreach, and we'll bring it
Yeah.
there. So
And then if you join, you get $25, I think.
I get
I
25. Are
forgot.
all these things
Yeah.
free, Dr. Rivera? All the
Yes.
blood work and all that are
Yes.
free?
Yes.
A while ago, Dr. Rivera, you mentioned about the value of participating in research like this. If you are going to select the top answer, if someone asks you why I as a minority should join in the All of Us research program, what would be your answer to them?
Yeah, because you only don't think about yourself. You also think about the future. So
Okay.
this will help, you know, the future of healthcare, right? In terms of accelerating the research and improve health. And this is very, very important. I'm not doing this to myself because I know I have all those diseases, but maybe they will find out something different, right? They will look at my biology, my lifestyle, and the environment. You know, when I was growing up, oh my God, I love sweets, let me tell you. But, you know, now we know that's toxic. So, but you could have a little bit, not a lot, all right? So, and these are, you need to learn really genetics and genomics. This is very important. I know that we don't have genetics and genomics classes when we were in school, right? But now the BSN program, they have that, genetics and genomics. I don't know with Manny, did you take genetics and genomics classes?
Well,
Uh,
introduction when we entered, when we started our undergrad
yeah, but now it's
nursing.
really they really have
Oh
a
yeah,
class
the
for
advances, the
yeah.
advances.
It's great for the BSN program.
Yes,
Yes.
yes.
Yeah.
You seem so passionate about this. So passionate because
Yes.
it affects you
I'm
personally.
passionate with research as well.
That's yeah. How
Don't get me
did you
wrong.
get? So my question it goes there. Why are you interested so passionate about nursing research?
When I was growing up, right, you know what really introduced me into this when I moved to psychology? And I said, and then I took a lot of statistics classes and experimental design. I appreciate it differently because the way it was taught in nursing is different. Like the way it was taught in other, because nursing is really providing care, etc. But then psychology, they have a lot of classes on experimental design and statistics. So then it motivated me like, wow, this is another way of really say proving to people that this is really effective. I learned it and I said, that's the reason. Thank goodness I went into my psych and then went back to nursing, and was so helpful to me. And I could, people, I could understand to read the, when I read abstract, before I see the abstract, okay, but then you need to look at the methodology, how it's done. So, and when you read an abstract, that's one thing that we teach is that you look at the methods. Then you go back to the methods and find out, if it's a sound methods to answer the questions. So, and we teach that in our peace model workshop. So,
So, as we wrap up, Dr. Rivera, you've discussed with us, you've shared to our audiences the benefits and also the importance of an increased representation of different population groups, including Filipinos and Asians, so that we could know more about ourselves. So, as we wrap up, may I invite you to share with our audience an advice, to those who are still having hesitancy in participating in research, what would be your message for them?
call me. That's very important because, even if, it's important that you need to be educated about
Mhm.
it, and also if you have some other doubts, trust the system, right?
Okay.
Trust, and that we are very transparent about this, and that participants are partners, and they shape the program with their input and contribution to a project that may improve the health of the future generations,
Mhm.
and also they may also learn about their own health, right? And that's very important, of course. It's about you and it's about others, right? And this is also part of me giving back.
And that is all that we have for this episode. I want to thank our guest, Dr. Ray Rivera, my co
Yeah.
host, Mindy Ofiana, our director and producer, Rodney Cahudo, Caro Robles, Chair for Communications and Marketing, our advisor, PNAA Foundation President Nancy Hoff, and our executive producers, PNAA President Dr. Mary Joy Garcia Dia, and PNAA Executive Director Carmina Bautista. Join us every Wednesday here on Rise Up. Until then, keep on rising and see you next week. This program is made possible through the NIH All of Us Research Program. PNAAF is a national collaborator of the Asian Engagement and Recruitment Corps launched by the Asian Health Coalition, which is a national community engagement partner for the NIH All of Us Research Program.